protection mechanisms, the muscles, they become more spastic. They try to fix their posture in a certain way. They don't like to move. So I think in short order, the muscles become over-fatigued and tired, and they hurt. Classically, the lower lumbar spine, we already talked about this, buttock, hamstring, down to the foot. If it's on the outside of the foot, it's probably S1. If it's to the middle of the great toe and the second toe, it's probably L5. Impress your friends, win money in the parties. Usually worse with sitting. Why is that? Kind of stretch the nerve, right? Normally, your sciatic nerve has to translate 1 to 2 centimeters, and the roots accommodate a lot of that as well in a normal situation. All of us sitting right now, all of your sciatic nerves are on stretch right now. You go up, you stand up, you walk around like me, they kind of relax a little bit. So most people will prefer to stand, and I can tell that they're pretty hot when they're in the room and they won't sit. So I usually look for some clues when I first meet people. That's one of them. They usually don't just have back pain, not if they've got a disc herniation. Like I said earlier, however, if they have one of these centrally located ones, where it popped out in the center, it's popped out in the middle, but you know what? There's just enough room for the nerves to get by. So the nerves that go down into the legs and sciatic aren't bothered. They're fine, but their back hurts. Those patients are a little bit, they're more challenging to treat and get them to feel better, but we can talk about that later. If they're lifting something or moving their bowels or sitting on the toilet and they push, mimic, if you're a female, mimic giving birth, push down, the leg will hurt, and it will hurt more. That's the Valsalva maneuver. All right, so questions so far? Yes, sir. So the question is there anything on MRI that can help you decide if this is an acute problem or is this a chronic-ish situation? And again, the answer is no. However, there are certain things that you look at. If there is a notable fragment that on T2 sequence appears to be T2 and T1 are two different sequences that they use in the MRI. So that the T2 tends to favor showing water and watery substances. That's how I look at it. T1 is more of a fat and that kind of thing. If it looks like it's bright on T2, and it looks like it's got some, I've actually never seen this, but in theory there could be a little bit of blood collection around the area if you get the MRI soon enough, some hematoma. That all speaks towards a more acute situation. That's the best we've got. The real best thing is when they have an MRI for some reason before